So I did my internship at Midstate Therapy, which is an outpatient clinic on campus in the Healthplex. And I got 135 hours there, which I'll be able to use for observation hours whenever I apply to OT school in the spring. And my supervisor was Cap LaCour, so he's a licensed registered occupational therapist, and he's also the only certified hand therapist in Central Louisiana. And in this clinic, you have one OT, two CODAs, which is occupational therapy assistants, and two OT techs working together, and they're all in the same gym as physical therapy. So they have two PTs, their PTAs, and all their techs, and they're working right next to each other in the same gym. And there's also doctor offices down the hall for the orthopedic clinic that it's connected to. So it's pretty convenient whenever doctors need to communicate with the therapist about anything about patients. They're right down the hall and they can talk about whatever they need. Some responsibilities. I did laundry, so the towels are very important there because most of the patients use hot packs and the towels are applied to the hot pack. And I would retrieve patients from the waiting room. That was weird at first because I've always been the patient in the waiting room, so going out there for the first time to call a patient in for their appointment, it was a little weird, but I would do that as they asked me to do that. And I would prepare and apply hot packs as they asked. Answer the phone, so whenever patients arrive for their appointment, the secretary calls back, and we will check them off the schedule and get their flow sheet ready for their appointment. I also got to take patients for treatment, so I actually worked hands-on with patients, so when they would come in for their appointment, I would run them through all their exercises and teach them technique and stuff like that, so that was pretty cool. And also, I actually got to work with some of my own teammates that were in therapy for shoulder injuries, so that was pretty cool, and also just like some athletes at LC that I already knew, I got to work with them too. Meaningful experiences, insights gained, and professional growth. One big thing was sitting in on the evals with the occupational therapist and being able to listen to him educate the patient on their condition and how we would go about treating it and getting them better. And also talking to the OT about the grad school application process. He's able to give me some insight on that. That was very valuable because he's actually on the admission board at LSU Shreveport. So, also talking about patients' conditions while observing them. So, like, if we come out of an eval, just talking to the OT just further about their condition and how we'll approach it exactly. And then also just watching patients in the gym exercise and, like, talking about their condition there while watching them. I got to do some hands-on things, like I got to do ultrasound on a patient, which I've never done before, so that was definitely some professional growth there. And I've never seen a fluido before, so I got to set that up whenever a patient come in for their appointment, and that was something new for me. And also, like, hooking up this stem machine on specific parts of their shoulder joints and whatnot. And then the big growth overall was just being able to do things hands-on, like working with patients in treatment, because I've never done that before. I've only observed in the nursing home and the hospital, like literally just watching. So being able to work with patients and actually like get a little hands-on experience helped me learn a lot better and get a different view of the field. But that was my internship.